Hello, everyone, and welcome to today's information session on the Discipline of Pediatric Medicine. My name is Lucy Heaney. I am from the International Office here at University of Galway. Today, I am joined by Amanda Walsh and Fiona Lowry, who will be bringing you through a presentation. Just some housekeeping before we begin. On the right-hand side of your screen, you'll see a live chat where you're welcome to ask any questions. I see Marie joining us there. You can ask questions. We'll hold a Q&A after the presentation. We don't allow email addresses or links to social media, but other than that, you're free to ask any questions about the presentation. Thanks very much. I'll hand over to you, Amanda.
Well, welcome everybody. I'm going to take you through an overview of the new programme that we're excited to offer here at the University of Galway. So it's the MSc in Podiatric Medicine, so it's the pre-registration course. So I'm going to take you through the background to the development of the programme, but also what the programme entails and what it can offer students with regards to a professional career in podiatry. So what is podiatric medicine to start with? We are a specialist healthcare profession, and we're dedicated to diagnosis, treatment and prevention of lower limb and foot problems and disorders that affect the foot, ankle and lower limb. So we are set within the remit of medicine, a branch of medicine that focuses on the lower limb and foot. So as a podiatrist, we are able to treat different conditions that affect the foot. And as a podiatrist, we're autonomous practitioners. So we are able to manage, we diagnose and treat and manage all lower limb and foot conditions for different aspects of patient care. So the MSc Podiatric Medicine pre-registration program, we established this so that we can offer prospective students a fast track. So those students that have a cognate degree, so have a degree already, to come onto the program and gain a degree in podiatric medicine in a 2-year period. So it's a 2 calendar year program. So it's the pre-registration course that would offer an option for mature students that have a degree to come in and gain an MSc Level 9 degree in podiatric medicine. So the new program is really designed to appeal to healthcare and other professionals coming into and wanting a career specifically in the field of podiatric medicine. And that allows our students to gain threshold level entry into the profession. We want to be able to train high caliber students, and certainly at a level 9 that can then progress on to graduation and demonstrate high level skills, enable them to become advanced care practitioners and managers and leaders, and really give them the skills at that level to progress into the profession and gain a very valuable career. So it is a 2 calendar year program. So it spans each year, there's 3 semesters. So the first year we are commencing this academic year 24-25. So it runs through the full calendar year, and year 2 will be 25-26. The fees for the program, they're listed there at the bottom left-hand corner. So different fees for EU and then international, and obviously plus student levies. So why podiatric medicine here at the University of Galway? Well, the University of Galway was founded in 1845, so we have risen in the rankings. So the university has an established position globally with research and where it sits within the rankings university-wise. So we're in the top 2% and the top 1% worldwide. And we are nestled within the city of Galway, and it's been classed as the most charming city by the New York Times. And 98% of the graduates from the University of Galway are working or in further education, generally within 6 months of graduation. So why podiatric medicine here at the University of Galway? We are the only podiatric medicine programme within the Republic of Ireland, and it is unique to the University of Galway. We have an established and accredited Level 8 Bachelor of Science podiatric medicine programme, which was established in 2008, so we're 16 years established running the podiatric medicine BSc programme. We have an established teaching team, and we have state-of-the-art clinical facility, which I'll talk a little bit about in a few slides' time. We have staff team that are internationally involved in research and have research output, which is a real strength to the program, in the fact that our teaching team and our collaborations within the university allow us to be able to do and to collaborate and do some high profile research within the field of podiatric medicine. We are embedded within the College of Medicine, Nursing and Health Sciences within the university, which allows opportunities for our students to engage in interprofessional learning across different disciplines. So medicine, nursing, midwifery, occupational therapy, speech and language therapy. We do interprofessional learning sessions and lectures that allow us to prepare our students for that multidisciplinary team working that they will then encounter in their working career as a graduate podiatrist. Within the College of Medicine, Nursing and Health Sciences, we also, we're integrated within that college to allow different disciplines to feed onto the MSc Podiatric Medicine program. So we have inputs from the disciplines like anatomy, pharmacology, general clinical medicine, and physiology, which is a real strength to the program to have the input of those kind of specialist areas and the specialist knowledge of the teaching teams within those programs. So, what podiatric medicine offer you or students coming onto the program? It really is an opportunity to gain a career to specialise in the foot and the lower limb, and it's a really exciting time for podiatry at the moment with regards to job opportunities, not only within Ireland but internationally as well. As a podiatrist, we work as part of the multidisciplinary healthcare team. So we are offering specialist knowledge, working alongside endocrinologists, working alongside vascular surgeons, working alongside different members of the healthcare team to really provide a holistic management and care for our patients. As a podiatrist, we work as autonomous practitioners, as I mentioned, so we are able to assess, diagnose, and manage conditions without, having to take direction generally from other disciplines. But we do work within the multidisciplinary team and work with our colleagues to provide care for our patients and improve the quality of life for the patients that we see. It is a very practical, hands-on career. So every patient that we see is different. So as you see in the picture there, some of our students have orthotics in their hands. So it might be manufacturing an orthotic for a patient. It might be dressing a wound. It might be debriding an ulcer. It's a very hands-on profession. So it's very varied and it's very rewarding with regards to the patients that we see and the care that we can provide. There's lots of scope for further professional development. So as you'll see in a second, the scope of podiatry is quite varied, and you can specialise in different areas or have an interest in different areas, or you can go on to do further professional development and increase the skills in different areas, depending on where students' interests lie. So, as I mentioned, it is a varied and a very challenging job sometimes. It includes skills like problem solving, manual dexterity, and those types of things because you are treating patients and doing different clinical activities, whether it be an assessment or management of a patient. So the scope of practice of podiatry in general. So this just gives you an overview of the areas that podiatrists work within. But as a graduate of the MSc program, all these skills, apart from the foot and ankle surgery, which is on the right hand side there, which is a postgrad course, all the different areas there that are listed is included, and that's the skills that as a graduate podiatrist you would come out with, and those are the standards of proficiency that we map against to ensure that students meet all the different skills in these different areas. So on the left-hand side there, we have musculoskeletal medicine and biomechanics. Podiatrists are now much more involved in sports, and they have been for a good few years, but podiatrists are now on sports, the medical team of sports clubs and Olympic teams. So musculoskeletal medicine and musculoskeletal podiatry is an up-and-coming area. Podiatrists who graduate may go into private practice and set up and concentrate more so on musculoskeletal injuries, sports management, those types of things. So the sports medicine is an interesting and exciting part of podiatry. Podopediatrics, so the pediatric element with regards to treating children and managing pediatric complaints. The middle strand there is a high risk strand. So we see patients with one of the common areas is diabetes. But we have patients that have vascular problems, so they have compromised circulation, which affects the feet. And it's our responsibility as a podiatrist to be able to identify and manage and assess and treat those problems alongside our colleagues in the wider healthcare team. So we have patients that are classed as high risk, which may be kind of diabetes, vascular. They may have wound care, so they may have ulcers, and we also have the rheumatology. So patients with rheumatological conditions, different arthritic conditions, can suffer with different structural deformities that can lead to complications that need to be managed by a podiatrist. On the right hand side, we have minor surgery. So, as a graduate podiatrist of the MSc program, students will obtain training with local anaesthetics to be able to do minor surgery. So this is toenail surgery essentially. So partial or full toenail removals. And we take our students through all the training with regards to theory and practice of local anaesthetic administration. So the scope of practice is of podiatry and as a podiatrist is very exciting and an extremely rewarding career. So we work in a variety of different environments alongside different health professionals. So as I mentioned, we work alongside our GPs, nurses, physiotherapists, orthotists, and we can work in private settings, public practice, and some of our students will go on to do research, maybe go into further education. They may work in sports clubs, footwear companies, orthotic companies, those types of things. So what's the curriculum like? So I'm going to take you through the 2 years of the program just to give you an overview of the modules. And if there is any questions specifically, you can ask them at the end. So the first year, this is what the first year modules look like. So it's really grounding in a lot of the basics around anatomy, physiology, human motion and biomechanics. So thinking about structural and functional problems, but also thinking about the anatomy and physiology. So it all ties in. So the podiatric medicine practice one module is the clinical module, and you'll see this again in the second year of the program. So this is where students would gain all the clinical skills training and their clinical hours, which I will explain again in a couple of slides. So the clinical module is a large module which entails the clinical hours, the clinical skills, and the time in the clinical placements. We have a professional practice, healthcare and leadership practice module, which encompasses the different aspects of healthcare and healthcare leadership. We have our anatomy modules, so that's human body structure and gross anatomy of the lower limb. And they, as I mentioned, are led by our anatomy colleagues within the university. So really tailored specifically for our podiatry students to gain the understanding and the higher level understanding of anatomy, but then how that links into human motion and biomechanics, which links nicely into the human motion and biomechanics module. The physiology module is led by our colleagues in the physiology discipline, and we have our own module that's taking students through the integumentary system. So, skin and nail pathologies that affect the foot and the lower limb. Again, giving the grounding to students with regards to all the knowledge and skills that they require moving into the second year of the program. So structurally, this is how the first year of the program looks with regards to the modules. So some modules run over semester one and then cease, and then some other modules come then into play into semester two. So we have a suite of modules that would be over 2 semesters, or certainly the podiatric medicine practice one runs over 3 semesters. So the podiatric medicine practice one in the third semester, that's when students will undertake their block clinical placement. So there will be, we have a dedicated clinical facility where our students undertake their clinical hours and the clinical rotations. So in that third semester of year one, that's when the block placement will be taken by students to undertake their clinical skills and be treating patients. So other modules may run over semester one or semester two. So structurally, that's how it looks for the first year of the program coming onto the program in September. Year two of the program, so just to give you an overview of the modules, and I won't go into too much detail of those, but you can see the podiatric medicine practice 2 module. So again, this is the clinical module. So this is consistent with year 1 and year 2 as the clinical skills run through the whole program. So again, this module is where students undertake clinical skills in assessment, diagnosis. They undertake different rotations in clinical skills. So they may have a musculoskeletal clinic that they would have up at our Melon Park facility. They may have a pediatric clinic. So they rotate through different specialists and different clinics to gain different skills in different areas of managing various types of patients. There's a research dissertation, so there is a research element required of the programme to undertake. We have a lifestyle and clinical medicine module that takes students through all the different disease processes that might affect the lower limb and how we manage that and how we work with our colleagues within the multidisciplinary team to manage those conditions. We have a dedicated pharmacology module that's run by our colleagues in the pharmacology department within the university. So this has been tailored again for the course particularly, so that really tailors training around the pharmacological knowledge that podiatrists require in clinical practice. Musculoskeletal medicine across the lifespan includes pediatrics and also adult musculoskeletal medicine and sports. So that really is around kind of musculoskeletal conditions and how we manage them when we're with orthotic and kind of gait retraining, those types of things. And our professional practice and healthcare leadership practice 2 module really builds and includes aspects of working with vulnerable adults and thinking about how students might plan if they were considering private practice or working within the public sector, and taking you through skills with regards to those higher level kind of skills that's required in clinical practice. So our clinical placements are completed, so the students on the MSc programme are required to undertake a minimum of 1,000 clinical hours over the 2 years of the programme. And this is a requirement that we have to complete those hours. So they will be completed at our Melon Park facility. So the bottom picture there is Melon Park Hospital, which sits just on the outskirts of the city centre. And the unit in the middle there is Unit 3, which is our podiatry unit. So we have a 20-chair dedicated state-of-the-art facility that allows students to be able to rotate through different clinical rotations and see different patients, as it is a community service run by the HSE. So our students gain those experiences in that facility. There are also opportunities for multidisciplinary placements. So because we sit within the hospital setting, we are able to offer kind of day placements and to kind of orthopedics and diabetes and vascular settings as well. So we have a whole range of clinical staff as well as academic staff that help to support students through their clinical journey and through those clinical skills at our Melon Park facility. So it really is an amazing facility that helps us to be able to provide the training that our podiatrists require on the MSc program, but also the BSc program. So we have this established facility, and it is a great facility that allows us to do the musculoskeletal training. Students really enjoy being on clinic. They gain experience from different members of staff, both academic and HSE employed staff. So our HSE partners, it really does allow us to embed the knowledge and skills. The top left-hand picture there is the surgical suite that was built onto the unit a few years ago now, which allows our students to be able to practice and perform things like nail surgery, but also gain experience with different disciplines that might come in to use that facility, like plastics and dermatology that may come in. Students may shadow those clinics as well. So what are the opportunities after graduation with regards to the MSc, and where do students go? Now, obviously, the statistics that are stated on the screen here, we did an audit of employment based on our BSc program, so our undergraduate program. So our undergraduates, are going into employment, and it's a very exciting time for podiatry within Ireland, but also internationally as well. So we do have international students that come through onto our BSc stream that will go back to the relative countries, and they are setting up practice and establishing podiatry within their own countries. So it's a really exciting time. So there's several kind of ways, I suppose, with regards to career opportunities. Some podiatrists may go into private practice, and a lot of our undergraduates, our BSc graduates, have set up practice here within Ireland or potentially internationally. And then there is opportunities to go to work internationally. The program, the BSc program, and then the MSc along the way is accredited by the UK and Irish societies of podiatry. The majority of our BSc graduates, like I said, may work in private practice. They may go overseas. They may work in public sector, which is the health service, and they may go into postgraduate study, come on to do a PhD or a master's program. They can go into work in footwear companies, orthotic companies, sports clubs, or, as I said, go into further education. So there's lots of different paths after our graduation that are really kind of exciting, and dependent on where students' strengths are, they can go on and seek a career, a further career in different areas if they wish to. So what are the course entry requirements? So we are, obviously, with it being a pre-registration program, it's really targets our mature learners that already have a degree in a cognate area. So at the bottom there of the page, we've listed some examples of cognate degrees, but it certainly isn't restricted to this. So these are just examples that we may feel that students may come on to from different programs. So the likes of nursing, biomedical engineering, anatomy, human biology, those types of things would I suppose, provide students with transferable skills onto the MSc Podiatric Medicine program, but it certainly isn't an extensive list. So we appreciate that students may have degrees in other areas, and we then will interview and explore that with regards to transferable skills and eligibility to come onto the program. So we do expect certainly graduates with an equivalent to a University of Galway minimum 2-1 degree in a cognate area. International students, we do require an English language, so that's outlined on the left-hand side of the page with regards to the IELTS score of an overall 6.5, so that's the minimum requirement. We do also have different prerequisites, so when students come onto the program, we do require GARDA vetting, and as part of the program, we do require mandatory vaccinations, and those are standard healthcare vaccinations that all medicine students would go through. So the application process, just to give you an overview, so the documentation that's required as part of the application is the official qualifications and exam results transcript, English language competency if it's applicable, with regards to the score, a personal statement just outlining why students wish to undertake the program and experience, transferable skills, previous career, those types of things. Passport and birth certificate, current CV, and 2 written references, 1 professional, ideally 1 academic, but if there isn't an academic, then 2 professional will be accepted at either. So there's different levels of our application and screening process. So when applications come in with the appropriate documentation, we will screen that and then invite those appropriate students that meet the criteria onto interview. And then at interview stage, what we will do is we will use a matrix to be able to then screen and look at the candidates with regards to eligibility onto the program post-interview. So just, I suppose, finally, why students love Galway. We have some international students on our program, and obviously we have a mixture of mature students, international, and EU students on our BSc program, which is a really nice mix. And speaking to all of the different students on the program, they really enjoy being in Galway. The university is nestled within the heart of the city, and when we say it's a city, it's not a large city. It's easy to get around. It's small. It's friendly, It's a very friendly city. So students feel very safe, and culturally, there's always something happening within Galway. So it's a really kind of exciting city at different times of the year when different events are happening, and certainly when the sun is shining, when it's not raining. It's an absolute beautiful city with lots of different aspects and lots of different places that can be visited. Well, nestled within the heart of the wild Atlantic Way, so lots of scenery to see, and accessible to different areas of the country as well, with only within the 2-hour drive from Dublin. So students feel, I suppose students like being in Galway. It's easy to get around, and there's an energy around the city which people find and students find really engaging. So if you want to find out more, we have a email address there, and there is a course page link which gives an overview of the program and all different aspects of application process and how to apply, and fees and all different elements. So if you wanted to take a screenshot and have a look at the course page link, or email us, or obviously ask a question today, you can email us and we can get back to you with any specific queries that you might have. Thank you for listening.
That's wonderful. Thank you so much, Amanda. Our live chat is still open if anybody wants to ask any questions. That was really comprehensive. There was so much information there. Thank you. We can wait a few moments for people to write anything if they wish. Thank you. Don't think we have any questions, but if you do have questions, for those of you watching now, or if you were watching the recorded version of this webinar, we have a page here on this platform where you're welcome to ask questions of our student ambassadors as well. I see Marie has a question there coming in. If you can see it, Amanda.
Okay, so does the clinical placements take place over the summer or all semesters? So the majority of the hours will take place in semester 3. So that will be from May to August in the semester 3 of the program. We may have short placement hours within the semester as well, but the majority of the hours, the block hours, will be in semester 3. So that's when the majority of the clinical hours will take place, because our undergrads will not be on clinic. So we have opportunity and space to have a block placement for our MSc program. So semester 3 will primarily be the clinical placement block, if that helps to answer your question.
Perfect. Thank you. Thanks, Marie. Ken, just see there.
You're welcome.
So one more, does the external modules like anatomy and physiology take place with other programs and students? Yes, they are shared. So certainly the human body structure, which is in the first year and the first semester of the MSc program, it is shared with different disciplines. The gross anatomy of the lower limb module is specific for podiatry students. So that's podiatry focused only. Physiology is shared as well. So some of those modules are shared with other disciplines, and that's a strength with regards to interprofessional learning, but also from those discipline perspectives. They tailor those with regards to the different disciplines that are feeding into those. So you may not be in with medicine, but you may be in with kind of occupational therapy or speech and language therapy in those kind of physiology and anatomy modules.
Thank
You're
you very
welcome,
much.
Marie. That's okay.
Yeah, so as I was saying, anybody who has more general questions, you can ask them from any of our international student ambassadors on this platform. Information about campus or life in Galway or whatever else. I don't think we have any ambassadors from this particular course, but we'll try and answer any questions you might have. Now we can wait a few moments more for more questions if you have them. I think that seems to be everything. Thank you so much, Amanda and Fiona, for joining us today. I'm sure you've gained great interest there, and it's good to have your email address as well, Amanda, if people want to ask any questions of you in future. So thanks very much, everyone, for joining us today.
Yes,
Thank you.
thank you. Thank